Hello and welcome to M.D.Zafar lectures. Today we will talk about disorders of lacrimal system. If you are new to my YouTube channel, kindly subscribe and share with your other medical friends. Now the aims and objectives in this lecture would be to understand different clinical problems associated with the lacrimal gland and the lacrimal passages, and to understand medical and surgical management for these clinical problems. We will divide lacrimal system disorders into lacrimal gland disorders and drainage system disorders. Lacrimal gland disorders include inflammation. Cardinal signs of inflammation include redness, heat, swelling, pain, and loss of function. It could be acute if it is present in a short period of time, and if it progresses from a long period of time, it will be chronic inflammation. Secondarily, if the lacrimal gland function has decreased, it will cause a dry eye. But if there is excessive amount of lacrimation, it will lead to wet eye. Talking about the drainage system pathologies, they would either be congenital or acquired. In acquired, again, topmost would be inflammation, chronic or acute, and then epiphora, which is the obstruction, which could be caused by any pathology. Now, first of all, the inflammatory disorders of lacrimal gland, known as Dacro-adenitis, they would either be acute or chronic. In acute Dacro-adenitis, the etiology includes infections like viral infection or bacterial infection, and in viral infection, mumps is the most important cause. Talking about the chronic inflammatory disorder of the lacrimal gland, it is also associated with chronic infections like TB and syphilis, which remain for a longer period of time in the body, and then it dissipates to different regions of the body, and one of them in case of TB being the lacrimal glands. Then trauma like by a foreign body. As we have talked about different ocular injuries, for example, if iron gets stuck in the eye, it can lead to a specific reaction which eventually leads to inflammation of the surrounding structures, and one of them may be the lacrimal glands. Then autoimmune problems like the Sjogren's syndrome, which is the autoimmune destruction starting from inflammatory response against the lacrimal gland, leads to eventual destruction, is also one of the cause for chronic adenitis. Now talking about the clinical features. The topmost differentiating feature between acute Dacro-adenitis and chronic Dacro-adenitis is presence or absence of pain. In acute inflammatory response, there will be pain and discomfort, but in chronic, there will be no pain. The characteristic feature for Dacro-adenitis, be it acute or chronic, is the S-shaped curve of the eyelid. Let me explain this from the diagram first. Now see in this diagram, as we have already talked, that the lacrimal glands are present in the upper and outer portion of the orbit. Now, if they get inflamed, they will become red, they will become hot, they will swell. Now, this swelling will cause this eyelid to move downward and have a specific and characteristic S-shaped configuration. Now, further, the displacement of the eyelid will cause the eyeball to move downward and inward, and again, it will be painful in case of acute inflammatory disorder, and it would be painless in case of chronic Dacro-adenitis. Now, eversion of the eyelid, that is the uplifting of the eyelid, will be painful and will show swelling in case of acute, but this eversion will be painless, but still there will be swelling, which is one of the signs of inflammation. Now again, understanding Dacro-adenitis from the diagram, there you could see the redness, swelling, it will be warm on touch, and it will result decrease in the function of the lacrimal gland. This S-shaped configuration is the cardinal sign for Dacro-adenitis. Now we will talk about the treatment for the inflammatory disorders of lacrimal gland, and they include treating the cause. For example, if there is an infection, treat that infection. If it is foreign body, remove that foreign body. Or if there is some autoimmune problem, we will have to give certain drugs which will resolve that problem. Apart from that, if there is development of purulent discharge that shows infection, specifically local or systemic antibiotics could be given. Then for the pain, as in case of acute problem, analgesics would be prescribed, and hot fomentation. Now, hot fomentation is a process in which a cloth is soaked in a material that is antiseptic, and it is placed over the specific part of the eye. It reduces inflammatory response. Then if it has surpassed all the medical treatment, then incision and drainage would be the necessary step to cure the problem. Now further we will talk about dry eye. Whenever the lacrimal glands have hypofunctioning or they're completely destroyed, they will result into decrease in the lacrimal fluid. When there is absence of lacrimal fluid, there will be irritation, redness, and blurring of the vision, because when there is a reduced amount of lacrimal fluid, the blinking of the eye will produce friction, and with that friction these symptoms will be produced and it will eventually fatigue the eye. Eyes will become very painful, and this is known as keratoconjunctivitis sicca, otherwise known as dry eye. Now talking about the causes. Congenital causes include congenital agenesis, that is the absence of formation, damage to the trigeminal nerve, or idiopathic hyposecretion. Vitamin A deficiency also leads to dry eye. Now we will talk about 3 specific conditions which specifically reduces a specific layer of the tear film. If the meibomian glands are affected, they will decrease the lipid layer. Autoimmune destruction by Sjögren's syndrome occur, it will reduce the aqueous layer, and if burns or trachoma infection occur, it will reduce mucin layer. Now we will talk about the pathophysiology of keratoconjunctivitis sicca. Now what happens is, because of absence or damage of the lacrimal gland, there will be dry eyes, and this will lead to tiny aberrations, because with every blinking of the eyelid there will be frictional force which will cause these abrasions and redness and swelling of the eye. Now in advanced cases, if the frictional force is too much, it will even cause squamous metaplasia and loss of goblet cells. Now even severe cases can cause corneal surface thickening, corneal aberration, epithelial defects, corneal ulcerations, and eventually corneal perforation. So we have to identify this dry eye pathology in early stages, otherwise irreversible damage can even lead to blindness as well. Now I will talk about the diagnosis on the basis of symptoms which include dryness, irritation of the eye, fatigued eyes, but there are specific tests as well to confirm your diagnosis, which include tear film breakup time. If it is less than 10 seconds, it indicates dry eye. Rose Bengal staining will show dead epithelial cells because of frictional force damage. And there's a specific test known as Schimmer's test. In this test, Whatman filter paper number 41 of measurements 35 mm long and 5 mm wide is used, and if the wetting is under 5 mm with or without anesthesia, it is considered to be a diagnostic test for the dry eyes. So now we will talk about the treatment of dry eye. It includes artificial tears, which include cellulose derivatives, polyvinyl alcohol like liquid film, and mucolytic agents, which include 5% acetylcysteine. Now this mucolytic agent will help in reducing the viscosity of the thick tear film, and we can also use topical retinoids, which help in reversing the cellular damage that has occurred as a result of frictional damage. Now I will talk about watery eye. In watery eye, there is excessive amount of lacrimal fluid which is coming out of the eye. It could be either because of defective drainage or hyperlacrimation. Hyperlacrimation occurs as a result of irritation by a foreign body, but the defective drainage could be an anatomical defect or physiological defect. In anatomical defect, the most important example include nasolacrimal duct obstruction, which could be congenital or acquired. We'll talk about that later on. But also physiological defects like the failure of the pumping system, which will result when there is facial nerve damage. The pump will not be able to take the lacrimal fluid out of the eye, and there will be excessive overflow that is known as epiphora. Now talking about the pathologies of the drainage system, which would either be congenital or acquired. Now the acquired causes include inflammation, be it acute or chronic, and obstruction. Now I will talk about nasolacrimal duct obstruction. Before diving into the understanding of the pathology, let me revise the anatomy first. First of all, at the medial canthus of the eye, we have these puncti, which forms vertical and horizontal canaliculi, which will eventually form the common canalicular duct, which opens into the lacrimal sac. Lacrimal sac narrows down into nasolacrimal duct. Nasolacrimal duct ends in the inferior meatus of the nose, and at the end it has a valve. Most importantly, this valve is known as the valve of Hessner. after revision of the anatomy, let's get into the pathology. Now, nasolacrimal duct obstruction is the obstruction of this duct, which would either be congenital or acquired. And this obstruction will lead to excessive overflow of the tears. How? Tears are supposed to move this way, but this is obstructed. Now they will remain here and at the medial canthus of the eye, and they will come out of the eye from here. That is excessive overflow of the tears known as epiphora, which is the characteristic feature. Now we'll talk about the causes. First of all, the acquired causes, then we'll talk about the congenital causes. Involutional stenosis is the most common cause of nasolacrimal duct obstruction in adults, and it results from narrowing of the duct secondary to infection. Now, trauma of the nasoorbital portion and inflammatory diseases like sarcoidosis and dacrolith or neoplasm are the other acquired causes for nasolacrimal duct obstruction in adults. Now, congenital nasolacrimal duct obstruction or dacrostenosis occurs when the lacrimal duct has failed to open at the time of birth, and it occurs most commonly because of the imperforate membrane at the valve of Hessner. Now, if this portion is imperforate, the nasolacrimal duct will be obstructed, and it will lead to epiphora, as already explained, excessive outflow of water because of this obstruction, and in this portion there will be overgrowth of the bacteria leading to infection, which will produce mucopurulent discharge. These 2 points are the most important characteristic features of congenital and acquired nasolacrimal duct obstruction. Causes of epiphora in a 2-month baby is either congenital nasolacrimal duct obstruction or congenital dacrocystitis. Now, symptoms manifest around 3 to 4 weeks in 80 to 90% of cases and include watery eyes, that is epiphora, and bilateral sticky mucoid discharge because of infection. This is the mucoid discharge, and this is the appearance of excessive watering from the eyes. Now we'll talk about the treatment of congenital nasolacrimal duct obstruction. In 90% of the cases, it will resolve spontaneously within first 6 months, but if it does not, then we have 3 levels of treatment. For the age of less than 1 year, we have Krigler's massage. In this, pressure over the sac increases the pressure within and ruptures the membrane, and in this we advise the patient's attendants or parents to give 10 strokes 4 times a day. If it does not help in the age of 1 to 3, probing under general anesthesia is the required treatment. In this, a probe is passed through the puncti, then to the canaliculi, then to the lacrimal sac, and into the duct, and it overcomes the obstruction at the lower end, and it results into 90% success rate in the first attempt. If it does not succeed, then we have a second attempt, and it has a success rate of 6%. Now, if probing has failed, then we wait till the age of 5 to 6 years, and we perform an operation, Dacrocystitis, which is also the treatment for adult nasolacrimal duct obstruction, in which a connection is made between the lacrimal sac and the middle meatus to allow the flow of the tears into the nose so that there is no more obstruction, and it resolves the condition. The complications include mucocele formation, dacrocystitis, we will talk about this in detail, conjunctivitis, and fistula formation. Now we will talk about inflammation of the lacrimal sac, which is the part of the drainage system. Acute inflammation of the lacrimal sac, known as acute dacrocystitis, is caused by infection which is secondary to nasolacrimal duct obstruction. It is caused by strong organisms which include Staphylococcus, Streptococcus, Haemolyticus, and Pneumococcus. It presents with painful epiphora, swelling on the medial canthus, and purulent discharge because of infection. This is the medial canthus, and the swelling is a typical feature for lacrimal sac involvement, which occurs secondary to nasolacrimal duct obstruction. Now, if we do not treat this on time, it will eventually result into cellulitis, abscess, and fistula formation. Talking about the treatment, we can give antibiotics, both topical and systemic. We can give analgesics and anti-inflammatory drugs, and hot fermentation is also effective in curing the inflammation of lacrimal sac. Last but not the least, we will talk about the chronic inflammation of lacrimal sac, that is chronic dacrocystitis. It results from impaired outflow from the sac, which leads to stasis and infection, but this time low virulence organism. It is more common and occurs in adults, and it presents with constant watering from the eyes and eventually leads to mucocele if not diagnosed and treated properly. And the treatment is dacrocystorhinostomy. Thank you for your patient listening.